Hello, this is Dr. Marzon from CIC, Complete Injury Centers, and today we're going to be talking about cases that we see them very frequently at this office, and we treat them daily basis basically, and that is basically having pain in the area and traveling the pain to the leg somewhere. And what we're going to be talking about today is what are the possibilities, and by saying that, it is very important for the clinician to listen to the patient, how they describe the pain, and also knowing that what is the onset and what makes it worse, what makes it better. All of those give us some clues to see that what type of issue the patient might be having. But again, the complexity of the problem varies from patient to patient, and sometimes they have multiple areas that they have issue with. So we have to see that what they have so we can have the best treatment plan for the patient to get better and recover faster. Let me explain to you what we are talking about. And this model shows that we have the hip joint right here, we have the pelvis right here, we have the sacrum right here, we have the lumbar spine right here, and there are the nerves, which are called spinal nerves. They exit between the vertebrae, and there is a hole between the vertebrae that these nerves travel. And between those vertebrae, we have discs, and here are the discs that between the two vertebrae in this case, and here's the nerve that exits at the hole, which is the foramen, between the two vertebrae. One is on this side, one is on the other side. So these are the spinal nerves. And then we're going to be talking about a joint right here, which is called sacroiliac joint. It is at this area right here. It is a distance this much, and usually patient is going to say, oh, I have a pain, not in the middle, but on the side, right at this area. And there is another area that we are going to talk about, is this area right here where the sciatic nerve exits and it goes to the leg. And this muscle right here is called piriformis. And this piriformis muscle, it is the muscle that the sciatic nerve passes by, through it, around it, and it is different from patient to the patient, from individual to individual. And then we have this bony structure right here is called the ischial tuberosity, which we're going to talk about that when we're going to be covering these issues on PowerPoint presentation. So the patient comes with the different scenarios. They're going to be showing different type of symptoms, and based on what they show, and afterward, doing the examination, we're going to see that what the problem is actually be in the area. And so if the sacroiliac joint is the problem, the pain would be in this area and goes down to the side of the leg, and it goes to the knee area, not to the foot. If the patient has a problem with the spinal nerve, it depends which level of the spinal nerve is the problem. They're going to have a different type of different areas of distribution of the symptoms, and we are talking about the sensory in this case, but each of those nerve and the spinal nerves, or the different nerves that they are dealing with the different part of the body, they have sensory and motor. So we're going to be looking at the sensory distribution to see that how that is going to be giving us the hint, because usually the patient comes, they don't say that I have the weak muscle usually, but they're going to say that I have a pain in this area. And then we can follow up with the questioning the patient that if the muscle is weak, and then doing the examination, we're going to see that what the muscles, what type of muscles and which area of the muscles they are weak. And so if this piriformis that we're going to be looking at that a little bit more detail on the PowerPoint, you see that the sciatic nerve, which is right here, it is very close to it. And so if this muscle is become irritated for some reason, this sciatic nerve can also be affected, and due to the compression, if it is going through it, or due to some type of pressure that you're going to be getting onto this one, that if the muscle is tight or shortened. Then we're going to be talking about this hip joint, which is right here. And this hip joint right here is very, very loose compared to other joints. The shoulder and the hip are very loose joints, and that's why the patients, they get a problem with that very often. And again, with that one, the pain that the patient is going to feel is going to be in this area right here. The pain that the sciatic nerve is going to cause, it varies. It depends on what part of the nerve is being affected and how much of that is affected. And then the distribution of this nerve is going to be coming from the area of the glute that goes down to the foot. So let me cover this causes and the symptoms one more time. And the cause of the damage to this spinal nerves could be the disc and disc protrusion, that each of these spinal nerves will cover different area of the body. So you need to know what part of the body the symptoms are covered by each individual spinal nerve. Then we have the sacroiliac joint right here, which is at this point, and that irritation of the joint causes the pain that goes here, and it goes to the knee area. If it is the piriformis, the patient is going to be having some pain in the glute, to the sacrum, to the hip, and if it is affecting the sciatic nerve, and the pain is going to go down, and it goes below the knee to the foot. And one of the nerves right here, actually two of the nerves, they are having some overlapping with the sciatic nerve, and that is the confusion among the practitioners and the clinicians. That is the L5, S1, and S1 mainly. They have overlapping with the sciatic nerve. But sciatic nerve, which is made of multiple spinal nerves, they are having a greater area to affect. So we're going to be talking about that momentarily on the PowerPoint presentation. I hope you will enjoy it. Thank you. We are back to our discussion to continue with the sciatic nerve damage and other issues which are similar to sciatic nerve symptoms. Again, this is the Complete Injury Centers. The topic is sciatica and distinguishing from other type of pain. And this is Dr. Marsman, and let's continue with the PowerPoint. Here are the areas that we are interested to talk about initially. And here is the sacroiliac joint, is between the sacrum and ilium. And this joint right here is very powerful joint, which is holding the upper part of the body and connecting it to the lower extremities. And so it should be very strong to hold our weight on two legs. And this joint can be easily irritated by any type of accidents, falling, auto accidents, sport accidents, and even bad posture, or someone has scoliosis in the spine, and that put the pressure on one side or both sides of these joints. And the other one that we are interested in to talk about is the spinal nerves. And the spinal nerves exit between vertebrae, and there's a hole on the side of the vertebrae, which is called foramina. And that the hole holds these spinal nerves. And these nerves, they have a sensory as well as the motor function. And therefore, if there is a compression or irritation to this nerve, it is going to be affecting sensory and motor most of the time. But we're going to talk about that a little bit more in detail as we go on. The other thing that we are interested in is the sciatic nerve to discuss. And the one thing we're going to come out of this slide PowerPoint page is that the sciatic nerve is not the same as the spinal nerves. And the spinal nerves, as you notice right here, from L4, L5, S1, S2, S3, and then all these nerves, they come together and make one nerve. And this nerve right here is not the same as the spinal nerves coming out from between the vertebrae. But the spinal nerves, they combine and they make up different nerves, in this case, sciatic nerve. And also, it is important to notice that each spinal nerve may make up more than one nerve. But we'll see how that goes. The other thing that we are interested in is the piriformis muscle right here. And the piriformis muscle is the muscle between the sacrum, and that goes to the hip joint and attaches to the bone. Sacroiliac joint dysfunction, which we have it right here between the sacrum and ilium of the pelvis, as we discussed before, it has, if there's irritation right here, damage, arthritic deformation, and joint dysfunction, the pain that the patient usually referred to would be in the buttock area where the joint is, and then it radiates to the side of the upper part of the leg, the thigh, and then outer part of the knee. And so this pain, it will not reach the ankle or the foot. So it is one of the key to this is that to distinguish this one from the others is the extent of the pain or numbness, or as well as we call it the paresthesia, any type of sensory dysfunction that does not reach the ankle and the foot. This one is the spinal nerve dysfunction. As we talk about that, the spinal nerve is not the same as other nerves that we are familiar with. They are numbered, and if they are coming from sacrum, it's called S, and then there are different levels, S1, S2, S3, or 4, and so forth and so on. If it's coming from the neck, it's called C1, C2, C3, so far and so on. Thoracic would be T, and the lumbar would be L. And so these nerves, they have this different types of distribution, and S1 is very powerful nerve that reaches all the way to the pinky toe and to the side, and also to a big part of the foot. And as it travels down, and this spinal nerve, if it is irritated, and in this picture it shows that it can be irritated by this protrusion. This is the annular fibrosis, which is very tough tissue that holds this. It's called the nucleus pulposus, which is very liquidish fluid in it. And if there is a damage to the lower part of the spine, in this case that we are interested in, this nucleus pulposus, it can be penetrated out and give to area where the spinal nerve is passing by. And here's the foramen between the two vertebrae that we talk about, the hole. And if this penetration goes back and to the side, which is called the posterolateral, back to the side, it can irritate this spinal nerve. And in this case, it will be S1 right here that is irritated, and the patient can feel not only to the back of the thigh, it reaches to the foot and to the side of the foot in this case. S1 nerve, the spinal nerve, which is affected by a disc protrusion that is happening between L5 and S1 vertebrae, and which is going to be the lower part of the spine. This picture shows that we have sciatic nerve. Here's a sciatic nerve right here. Here's a sciatic nerve right here. A sciatic nerve is different from a spinal nerves. A spinal nerves combination of those will come and make up the sciatic nerve in this case. And that is going to have a different distribution, different symptoms, which mimics most of the time with the L5S1 spinal nerve damage. And so if somebody has the S1 most of the time nerve root or spinal nerve damage, the symptom is very similar to sciatic nerve, but they're not in the same location. So for that reason, it is very important to distinguish between the cause of the issue, that the treatment would be uh, uh, being designed for that specific cause. And so if the damage is right here, you don't want to pay attention to this as much, or if the damage is right here, you don't want to pay attention to this area, because you're treating a different area that is not the source of the damage. And here is the sciatic nerve. And this sciatic nerve, how can be irritated, many times you see that it is because of this muscle that we talked about on the previous slide, which is called the piriformis muscle, that has attachment to the sacrum and also to the side of the hip joint. And here is the sciatic nerve that is sitting right here and has a distribution that goes all the way to the foot, outside of the foot, lateral side of the foot. And this sciatic nerve irritation, because if it is irritated because of the muscle right here, it is called the piriformis syndrome, which is very commonly seen in patients, and especially with patients that they cross their legs, or they have long lasting sitting job profession, and all of those can cause this muscle right here, piriformis muscle, to become tightened, shortened, weakened, and spastic, and all of those issue to this piriformis muscle can cause irritation to the sciatic nerve. If the sciatic nerve is issue right here, the area of the symptom would be much greater than L5 or S1 itself. So the gray area that the patient has issue with, it is giving us a direction that the cause of the damage is the sciatic nerve. And again, it is important to note that the patient might have a spinal nerve and sciatic nerve and piriformis issue and the sacroiliac injury, and all of those in one patient. And we see that very often. And therefore, it is very important to tackle and treat every single of those causes, because if you have a combination of issues in the patient, treating one will not be sufficient to resolve the problem. Here's the sciatic nerve location. So which one is it? Is it the spinal nerve, which is between the two vertebrae? Is it sacroiliac joint issue that is between the sacrum and the ilium of the pelvis? Is it the sciatic nerve that is exiting at the lower part of the pelvis, and it goes around within, and any different orientation possible that is different from patient to patient around the piriformis? But in addition to that, we might have, we do have patients that they have hip injuries, and that hip injuries could be because of falling from motorcycle, bicycle, sports, even in the auto accidents, which the knee hits the dashboard and it jams this joint right here. And also arthritis, aging, wear and tear, and it is all could be possible cause of the joint issue in the hip. So here is the pelvis right here, and here's the femur right here, and there's a joint which is having a cartilaginous coverage, which can become thin and during the aging, and thinning out of this cartilage can cause the space between the two bony structures right here to become reduced, and it is going to be affecting the blood flow in the area, and therefore over time it becomes very irritated and painful. And the pain that in this picture shows in the pinkish area with the hip injury, it would be in the area around the hip, back of the buttock, and the front, which is the groin area. But let me show you this picture again, and that the piriformis, which is right here, it is the rotator muscle to the hip, and therefore if there is the irritation to the hip itself, it causes the muscles which are attached to this one pretty much, and it is always affecting this piriformis muscle due to the joint issue in the hip. And this piriformis muscle, in order to protect the joint, it becomes tightened, or also because the joint is not functioning well over time, it causes this muscle to become weakened and shortened. And due to that, it is going to be also causing the sciatic nerve to become compressed, and therefore the hip joint, it is causing this piriformis muscle to become tightened, shortened, and spastic, or a combination of all of those, and which is going to cause the sciatic nerve to be irritated, and it causes sciatica due to the hip damage. So it is important to distinguish what the problem is in order to fix the problem. And again, we talk about the piriformis syndrome, and in this case is due to the hip dysfunction. Finally, we're going to talk about this one, which is very important nowadays in our social lifestyle. It is the sitting and lack of walking and movements of the legs. And because of that, this, I'm sure all of you are familiar with this muscle right here. There are glutes, and there are 3 of those, which I don't want to be boring you with the names. They're huge, and they should be huge, and they're strong muscles for the walking and gaits and balance and all sort of things. But because of the sitting and not being as active as we should be, these muscles become weakened and become small. And one of the things that this muscle are going to do, besides every other things that we just mentioned, the gaits and balance and posture and everything else, it is also a cushion tissue right here that when you sit, your bony structure right here, and this bony structure is the bony structure that you sit on it, on the chair. And so if you don't have a cushion muscle right here that holds and does not put the pressure on this bony structure, this nerve that comes out can be compressed against this bone. This is sciatic nerve. So the sciatica, it could be caused by multiple different ways. And we talk about the piriformis syndrome, and now we are saying that if the gluteal muscles they are weakened, it causes a loss of the cushioness in the buttock area, that when the patient sits, this bony structure can cause the pressure on this nerve, or the chair that you're sitting can easily compress this nerve. So it is very important to do the gluteal exercises, as you can see in younger people or older people in the middle age. The buttock size are not as big as it should be because of the loss of the muscle mass in this area due to the lack of movements, lack of exercise. I hope that you enjoy this review, which was fast, but hopefully will be educational to you, that what the problem you have and how we are trying to help you with the case that we are trying to fix it for you. And also, hopefully, it is educational to the practitioners and the clinicians that would help them to distinguish between the different causes of the buttock and leg pains. You have a wonderful day.